Greetings. For this discussion, I will be doing a brief about my DNP project, which is utilizing the GAT7 screening tool or screening instrument for assessing and diagnosing of anxiety disorder in adults 18 and above. Anxiety is among the most common mental health conditions in the United States. According to the National Institute of Mental Health, 1 in 5 adults experience an anxiety disorder each year. Despite the high prevalence, anxiety frequently goes undiagnosed and misdiagnosed in primary care settings. So, my goal is to foster a program in the primary care setting, which we are going to implement the GAT7 screening as an instrument to assess and diagnose anxiety in patients 18 years and above. Many patients present with physical symptoms such as fatigue, insomnia, headaches, or GI concerns, which mask the underlying conditions of insomnia, but in reality, which marks the underlying condition of anxiety, which in reality they have anxiety. So the purpose of my DNP project is going to improve early detection, early identification, and early diagnosis of anxiety with a 100 compliance rate. In addition, I am going to strive to have 100% referral of those who are diagnosed with severe anxiety because we do need treatment. And the GAT7 instrument is very brief to use. It is validated, it's been evidence based, and it's simple. It goes across 7 questionnaires, and we score them from 0 to 21. It takes less than 2 minutes to score. And based on the scoring, we are going to rank the patients as mild, moderate, or severe anxiety or no anxiety. And we are going to have a protocol that we are going to use to refer these patients for management based on productivity. The key problem I identified in this clinical setting where I did my was the lack of proper screening tool or instrument, and there were reliance basically on subjective clinical data without any standardized tool for screening. And sometimes some of the patients went overlooked and their treatment was either delayed or denied, which is not good. And to address the gap in practice, this project would focus on 3 things: implement routine GAT7 screening for all adult patients during primary care visits, educate providers and nursing staff on proper scoring and interpretation, and evaluate whether implementing improper diagnosis accuracy in treatment planning. The interventions include staff training session, which is going to take about an hour, and everything is going to be integrated into an EHR, which is password protected. This EHR is accessed only by the program coordinator, which will be destroyed 3 years afterward. And the significance of this project extends beyond clinical site. Standardized anxiety screening promotes equitable care, reduce stigma, and supports whole health management, which is good in early detection and prevention of screening. And in conclusion, utilizing the GAT7 as a routine screening tool or instrument will strengthen clinical decision making, enhance patient outcome, and supports best practice in primary care to all our mental health patients. And at the end of the project, we are going to do a summative evaluation to assess how the project was implemented. Thank you.